Yes, and it goes back. Okay, good morning, everyone. Can everybody online hear us? Good to go. Awesome. Thank you. Well, good morning. Thank you for coming to our January investor meeting. We really appreciate having everybody here. As you can imagine, as always, it is a packed agenda. We are going to talk about COVID a little bit, but if I can ask everybody to kind of keep their masks on unless you're up here talking, we'd really appreciate it. Thanks again, Steve, for opening up the Center of Innovation for us to use. Like to thank our coffee sponsor, the payroll department. We have Mike here. I didn't see him come up. Anyway, if you see Michael, thank him for the coffee. He's the one that keeps us fueled. We will send around a sign-up sheet. If this is your first time here, please go to kind of the last page. There's area there to put your name, contact information, and then we can get you on our distribution list. And do we have any first-time visitors? Perfect. If I can get you all to just stand up, tell us your name, where you're from. We'd like to welcome you. Let's start back here.
Start back here. Okay. I'm Eric, and this is our video. We are from Colorado, and yeah, we are just trying to get involved in it, and trying to get some information, and want to see what you guys are all about. We got a reference from first. That might work coming here, so what you guys are doing. So looking forward to it, and yeah, thank you.
Super. Thank you. Morning.
Hi, good morning. I'm Dr. Chris Hudson, Chief Medical Officer at Mercy.
Morning. What we got next? I saw more hands than that.
I'm Dean Elmore. I'm with Marmor Roofing. We're out of Wichita, Kansas, Kansas City, Denver area, and we're moving out here, opening an office. Do residential, commercial, every type of roofing there is. We've done a lot of work for school districts in eastern Colorado. We're hiring Cortez. I'm not the owner. Ben Barhoff's the owner. He's going to be here at the next meeting, and we'll kind of do more introductions or questions or whatever. So glad to be here. Such a beautiful community. I'm excited to work with you.
Super. Thanks for coming to Durango. Morning, Joe.
Hi, I'm Julie Christie, and I am the new branch manager at Vector Bank downtown branch. So thank you for having me.
We're really excited to have Christy or Julie. Really excited. Anyone else? I thought I saw more hands. Okay, perfect. Well, thank you all for coming. We really appreciate it and are excited to have you. A couple of board updates. We had our board meeting last week. Packed board meeting, a lot of discussion around the 2022 budget. We made a couple adjustments, but did approve our 2022 budget. I would say from a budgetary and financial aspect, I think the organization is probably the healthiest it's been, which is kind of odd coming out of COVID. PPP funds helped a lot, but we're kind of trying to diversify some of those income streams strictly from kind of membership and go more into grant writing and everything else. So that's really helped. We did appoint board officers for the next year, so those are in place. We're really working on some of our storytelling, and this goes back to kind of the Roger Zalnaradis days. It's a piece that I think we continue to struggle with a little bit of just saying, hey, what do we do? What is the Economic Alliance, and what are we doing on a daily basis? And making sure that we're able to tell that story out to the community. You know, the organization is largely influential, but we don't hold the reins on anything. So that's something we're wrestling with. If anybody has any input on it, I'd love to hear it. I see Mitch nodding. He's a previous board chair, so he gets it. That really is the recap from the board meeting. At this point, I'll turn it over to Mike French for our executive director updates.
Good morning, everybody. I'd say Happy New Year, but it seems like New Year's was a month or two ago. Gosh, we're living in wonky times, I'll tell you that much. It's been a very busy 4 weeks, even including the holidays. Last week, the Alliance hosted a workforce and attainable housing discussion for the broader community. It was really well attended. We had over 60 people dial in. It was a virtual event and had great engagement. The objective was to discuss what the Alliance is doing in the Attainable and Workforce Investment Plan. We have Jen Lopez with us today. Thank you, Jen. And she'll give us a more comprehensive update on that project. Speaking of housing, the housing stats came out just this week. In Durango proper, the numbers showed very slow activity on top of a very depleted market. We have less than a half month supply of inventory. I think that this is being generous in terms of inventory for sale right now. Being 11, I think it's less than that. And the average price for single family homes in Durango proper jumped 21% in the year of 2021. So all the numbers are in for the entire year. For the county, the trend follows, not much difference in terms of inventory. The numbers are a little bit softer, but not by much. After our last meeting, literally just a couple of days after we met last time, we hosted a La Posta landowners meeting for 21 landowners in a potential city annexation area. And it was a very healthy conversation. The next steps are individual meetings concerning land use code or land use for those specific owners to make sure that that would work for them. The city is probably going to enter into an IGA with the county to discuss how they collectively would move forward and make the infrastructure investments that they both have budgeted for. We will also start infrastructure planning and cost estimates in the next few weeks. And Scott Shine from the city will give a more comprehensive update either in next month's membership meeting or the following in March. So be patient, but I can't tell you how excited I am that this ball is getting rolling. And I'm extremely optimistic about what's going on here because it's not just light industrial, but we're talking about workforce housing in the area. Unemployment, very briefly, the La Plata County unemployment numbers came out last week for the month of November. It ticked up slightly from 4.0 to 4.2%. Not alarming. It matched the US number of 4.2%, and it is still outpacing the state of 5.1%. Laura Lewis is here with us today. She presented a detailed economic outlook at the FLC annual event last week, and I'm looking forward to her summary. So Laura, thank you for being here. I want to congratulate Commissioner Salka. Yesterday, he was elected the county commission chair, and we're really proud of him at being the representation to the Alliance board. So congratulations, Commissioner Salka, if you're out there. And lastly, the Alliance hosted a task force meeting yesterday with the San Juan Basin Health representatives in regards to the spike that we're having. I think it was really important to get ahead of some of the rumor mills that were going on in the business community. I was really happy to hear from San Juan Basin Health and what they're doing. Today, we have some community leaders, including Chief Medical Officer Christopher Hudson. Dr. Hudson, thank you for being here. Really appreciate your time and energy today. And we'll hear from Karen Chesser and Dr. Steve Elias, Dr. Chesser and Dr. Elias. We've got a lot of doctors here this morning. And they'll both also talk about the COVID response in the community. So with that being said, I'll turn it back over to Jameson. Thank you, sir.
We'll turn over to Dr. Christopher Hudson, if you want to give us an update on what Mercy's doing with COVID-19.
Well, good morning, everyone. I thank you for this opportunity to come and speak with you. As all of us would like to see this pandemic be over, unfortunately, that is not the case. We continue to be extremely busy out at Mercy. While our total number of COVID patients is slightly lower than before the holidays, the acuity of the patients that we're seeing is much higher. I mean, we have a significant number of ICU patients. We've surged our ICU capacity onto our transitional care unit. We've surged our transitional care unit onto our regular floor. So we have quite a few very sick people, quite a lot of patients on ventilators. I will tell you that the overwhelming majority of those who are on ventilators are unvaccinated. So I would like to take this opportunity to encourage everyone to get vaccinated. And if you're eligible for a booster, please get your booster as well. Staffing has been a challenge, not only at Mercy, but across the nation in healthcare. Recent studies have shown that up to 20% of all healthcare workers are planning to quit or have quit as a result of the pandemic. And so we continue to aggressively recruit and have done significant incentives to retain our employees so they can continue to provide care to our community. Fortunately, our caregivers are all part of this community. They're very dedicated to this community. And so they have continued to show up on their day off, on weekends, volunteer for extra shifts to make sure that we can provide the coverage to take care of our community. As part of Governor Paulus's recent plan and initiative to increase the number of beds available in Colorado, we are happy to announce we did receive some FEMA support this past week. We received 9 nurses and 2 respiratory therapists to help us out with our increased ICU numbers. And so that's been very, very helpful. We're appreciative of that. As we move into this Omicron phase, what we're seeing is a very highly contagious version of the virus. With that, we are seeing, as was mentioned earlier, a surge in the number of cases in our community. With that, we are seeing overall, it appears to be less severe illness, but anytime you have large quantities of those who are ill, you're going to have a certain percentage that are going to require hospitalization. To try to address those issues, of course, we want to encourage everyone to follow the precautions that we're all well aware of at this point: wearing a mask indoors, staying 6 feet apart, washing your hands, staying home when you're ill, and of course, getting vaccinated. Some of the therapies that we do have on hand now are going to be helpful for us as we treat Omicron. The first one is monoclonal antibodies. This is an infusion treatment that we provide through our emergency department by appointment when referred by physicians in the community. Omicron is a little different. It is only responsive as far as treatment to one particular type of monoclonal antibody, which is actually very hard to acquire. We're very fortunate as part of Centura to be allocated some of that monoclonal antibody so that we're able to treat those high-risk patients who do get sick. In addition to that, we're pleased to offer what's called a pre-exposure prophylaxis treatment of monoclonal antibodies. And this is for our extremely high-risk patients in the community before they get sick. And so Evusheld is the name of that treatment, and we're providing that through our infusion center at the hospital, starting with those at highest risk, like solid organ transplants, patients on chemotherapy, and other immune disorders. Additionally, there are 2 oral medications that have been recently approved, and we are fortunate to have a small supply of both of those. And so we've notified our primary care and specialty care providers so that we are able to offer those to patients who aren't sick enough to be in the hospital, but are at high risk. And so we can try to help treat them as well. Moving forward, we are continuing to perform drug testing through our drive-through testing site for patients and associates, as well as provide vaccine through our primary care clinics. From a staffing perspective, as many of your businesses may have experienced as well, we've seen a significant uptick in the number of our workers who either have had a high-risk exposure or have symptoms and thus are restricted from work. And so that also impacts our workforce, and we meet every day to look at our staffing, our census, our bed availability, and to shift resources from different parts of the hospital and the clinics to make sure that we can provide the care and continue to provide the ongoing care. We want to encourage everyone to continue to seek care if you have a medical condition. We also want to encourage those who have been putting off their preventive care, whether it's a colonoscopy or a mammogram, to please go ahead and still continue to seek that care. It's important not to delay care, as a lot of the higher acuity sick patients that we're seeing in the hospital, they're not COVID related, are individuals who have been delaying getting care for their chronic condition or have avoided coming in for care for a particular condition. with that, I think that's a quick summary. I don't want to take too much time, but I'm happy to stick around afterwards if there are any questions or specific topics that would like to be discussed. Thanks.
Super. Thank you, Dr. Hudson. We really appreciate what Mercy's doing to help keep everybody healthy. I'll turn it over to Dr. Karen Chesser, Superintendent of 9R. Morning.
Good morning, how are you? So happy 2022, everyone. I would love to be up here talking about all of the amazing work that we're doing in 9R. This way, right here. How's this? Is that good? Thank you. From our new buildings, Miller Middle School, Career Innovation Center, all our career exploration work, our Porch of a Graduate, all our extracurriculars, lots of really cool things going on. And I hope I can come back sometime and focus on that. But we know what the most urgent issue is right now, and that's COVID. So before I say anything else, I'm going to answer the probably most burning question, and that is, we are planning to stay in school, stay in school, stay in school. We have no plans whatsoever to go remote, and we're going to do everything possible to make that happen. And let me tell you a little bit about why we think we can do that, even though almost impossible circumstances, but also why we think we should. So first of all, I'll give you a little bit of the stats. We did have 60 cases yesterday, staff and students. That's up from about last week. Every day was in the 40s, new cases. Because we can do the 5-day isolation and most of our staff are vaccinated, almost 90% plus, we can't ask. So we only know if there is a positive case or an exposure, and then we have to dig a little deeper. But we know from our first vaccination
yesterday is
that we were up in the 90%.
Professor was there, and he is a Native American who likes to talk a lot. And
Okay, tell me to wait.
when I started saying, "Are there any questions?" he like piped.
It does is that prevents us from having to quarantine at the levels that other school districts might have to if they don't mask, because we have very few exposures when masked. We also have modified lunch, so we never have students without mask on, more than 15 minutes. We also are distancing. So we haven't seen any spread in school. We have no evidence of that. Any kinds of outbreaks or spread has happened outside of school. So we feel strongly that school is like the safest place to be right now. So with distancing, with cleaning, with masking, we have a test to stay program. Unfortunately, the state is out of test, is what we heard. So we do have a stockpile for right now. So we're going to continue these measures, contact tracing, so on. And also we have weekly serial testing for those families who choose that. So we have many, many things in place to help reduce spread. So really the issue would be the staff shortages. So what we're doing at this current time is a lot of creative measures. We are still recruiting substitute teachers, and we'd love for it if anyone here is interested or knows anyone. It's a great job. We also are being creative in a program where teachers are filling in for classes during their plan time. Every district office person is on a list. I've subbed. We're all going in as needed so that we can cover classes, again, because we are committed to being in person. We know what happens when we're not. We're now on 2 years of kind of interrupted schooling. And that's adding a lot of stress and threat, not just to our students, but our staff. When you don't have that consistency and we're not sure what's around the corner, that creates a situation where we can't do our best work. And so we want to give that consistency and standardization, and especially to our students. I know that we all knew that academics would be impacted, but I'm not sure that everyone understood the tremendous behavioral health and social emotional impact that this would have on students, really in two realms. One is with, too much screen time, I'll be honest. You may have seen the research studies that show that for older students, that's kind of resulted in depression. I'll be honest, I have my own child who was in college at the time. He had to leave and he experienced that because of just this, this strange time and having to do everything online. And then also for our younger students, it's contributed to ADHD symptoms. And so that's been a struggle because since our students haven't had the structure and the interaction and the practice with working with others, it's taken our schools a few months to even get back to sort of any kind of consistency for our kids. We've got to continue that or we are going to have long-term, lifelong impacts. So it's very important that our kids are in school for that reason and for our teachers. We also know the impact that has on the economy. And that our parents have to rely on school. It may have been a little different in our first lockdowns, right? Because there was maybe a little more grace. We didn't know what was going on. People could work from home. There were some more, lots of supports, and that's not really necessarily here now. So for those reasons, we are working hard to stay in school. I'm happy to answer any questions that you have. Yes, Jack.
You have to have a teaching certificate to be a volunteer substitute?
You absolutely do not. And, I don't know that we have any volunteer subs because we want to pay you. But no, you do not. It used to be that you had to have a college degree, but we have changed that. You just have to have some college, just some college in order to substitute. So we'd be happy to have you. Any other questions? We do need bus drivers. That's the one thing. We were this close to having to call off a route yesterday afternoon and just tell people they're going to have to come get their kids. So if you know of any bus drivers, please, people who would do that, please let us know. All right. One thing you can do besides just being a sub, please thank the teachers and the staff. They are doing yeoman's work, unbelievable, almost impossible work right now. And they are hanging in there and being really supportive of keeping kids in school. Thank you.
Thanks so much, Dr. Chesner, for just everything. Dr. Steve Elias, give us an update on the fort.
Thank you. I'll be brief, but I'll start with positive news with all this COVID. Next month, that screen will be gone and replaced with a 9-foot movie screen. So everyone, that is the God's honest truth. So, again, I'll be brief. The college thought it was in the best interest to delay the start of the semester because we're going to remain face-to-face like 9R. We just think it's important for our students to be on campus, not online as much as possible. So our classes will not start until January 24th. The college, since the beginning, we were one of the first schools in the country. You can go back and read it in the New York Times, believe it or not. We were one of the first schools in the country to require vaccinations. I think we're one of the first schools now we're requiring boosters. So students who are vaccinated, faculty and staff as well, will still need to get a booster to be considered vaccinated on campus and return to campus. So classes start January 24th. Our spring break, I could tell you I was a part of the process a couple of years ago to get our spring break in alignment with 9R's spring break. So we're not changing our spring break despite pushing the start of the semester back a week, but all other academic dates will be pushed back a week. So if you have a kid at the fort who's graduating and you've got their commencement on your calendar, push it back a week. Commencement will be pushed back a week. Finals as well. As long as folks are vaccinated and boosted and meeting the criteria, we're going to still be doing things face-to-face. We do require masks. But again, just like meeting down here, we feel pretty confident that our faculty and staff at the end of the fall semester, we had a 94 or 96% vaccination rate. So we were really excited. We contracted out with a hotel in town. So if a student does test positive, they don't return to campus, they go downtown and stay at the hotel for the required amount of time. And we're going to continue doing that for as long as we're in this unfortunate boat. Big change for us though is pushing the start of the semester back a week. And again, I'm happy to answer any questions. Can I drive a bus? The real question there is, would you want me to drive? 9 feet. Positive things. Thank you.
Thanks so much, Dr. Elias. Just one more thank you to Mercy, 9R, the Fort. These are big employers, and I think they're really taking all the proper precautions, trying to prevent the spread and keep everything under control, and obviously keep everybody in person. So thank you again, really, to the three of you especially. We'll go to Jen Lopez. As you know, the Economic Alliance, one of our strategic initiatives is workforce housing. Feels like it has been forever and a day. But we're going to hear an update from Jen Lopez today on Project Moxie.
Thank you. Just say advance. Space for advance, okay. Is this a good spot?
Yeah.
I always wander. Morning, good to see you all. I love this community so much. Oh, anyway, it's great to be in person, even masked. This is a quick update, but we're cruising right along on our work to come up with a 3-year strategy for workforce housing. So we've been interviewing many people. Many of you in the room we've talked to. We've got about 5 or 6 interviews left. Mercy Hospital, 9R, we're going to come back to you as well. I'm really excited about what we're hearing, and I'll talk about some of the themes around that. From a process perspective, by the end of the month, early February, we'll have a memo with high-level themes about what we need to be doing here to start to get housing on the ground. And again, there's already a bunch of momentum around different initiatives, and we just need to give it some push, some support, and some public money. Some of the themes we've been hearing so far from the interview. So again, we've been interviewing elected officials, staff at City County, Ignacio Bayfield, employers, developers, bankers. Lots of interest, conversation, and potential future action regarding land development. I mean, there is the potential for hundreds and hundreds of units in the pipeline. So what our team's doing this month is aligning what we think is the low-lying fruit over the next couple of years, and then bringing it back to leadership in the community saying, here's the path forward in terms of getting units on the ground. Here's what we think in terms of roles, who should be doing what, and how we just get things moving. A lot of questions to our team about how to access public finance and grant programs to increase below market housing opportunities. This is an interesting week. Tomorrow, we're going to be hearing about how the $400 million is going to show up for housing from the ARPA funds at the state level for what programs. So we spend a lot of time right now trying to just track all the money coming in. I just got an email this morning sitting here that Senator Bennett and Hickenlooper are releasing a framework for housing. I actually got to co-chair this effort statewide. I will send it to you, Mike. You can send it out to folks, and maybe next month I can highlight some of those strategies. You will see those strategies show up here locally as well. Really good stuff there. Heard numerous times, both in that process with Bennett and Hickenlooper, but also locally about looking at a modular factory. And I know that Mike Seacrest and others have been talking about this, so we're going to keep following up on that. We think there's a lot of validity and potential there. Always talking about capacity, and we know this. So again, lots of interest in getting the RHA, Regional Housing Alliance, up and running again. That won't be the only capacity we need. We always need development partners, private sector partners, and our local governments need help with all that they have going on as well. And then again, we know there's no homeownership units. I want to do a shout out to Lisa. She's a great partner. We're hyperventilating when we talk, so we're going to figure out how to get some units off the ground. So. Mike, here's our pitch for the employer survey. As part of the process, right, we want to hear more intimately, more detailed information from employers about the experience they're having with housing impacts and whatnot. It just builds a better case for funding when we're ready to act. Also helps us with strategy. Mike, where do they find the link? I apologize, I didn't put it in the PowerPoint.
We'll send it out again today.
Okay. If you would please just take 10, 15 minutes and fill that out, it really will help us along with this process, and we'll share the responses. I think we've only got about 10, so yeah, thank you. Some examples of what those survey questions are going to look like when you do the survey for us. And then phase 2 of our engagement at the end of the month, after we have sort of initial themes and sort of some ideas around draft strategy, we'll be doing more community engagement. So we've gotten emails about how do we get involved as community members or key partners in the community. We'll have a couple more large community forums where we'll be listening to people and sharing ideas. And then we'll have a few smaller working groups with folks that have land and money to figure out the implementation and the coordination there.
Our goal is to wrap up this draft report by April. Again, we're not waiting for the report to act. I know Mike is very busy continuing to align and match make and find resources, and our team is here to support those efforts as well. But April will have something that hopefully we can have folks endorse and is fairly clear how we move forward. That's it. Questions? I love it if they can go to Mike's team first and then to us, but happy to answer questions.
And we will get that survey, we sent that survey out probably 3 weeks ago, but the timing was rough because of the holiday. So we'll resend that survey out. It's really important that we get that feedback. And expect to see that in your inbox here in the next 24 hours.
Thank you.
Thanks so much, Jen. I'll preface now, we may run a little bit late this morning. We've got a little bit longer presentation on the economy towards the end, but we'll do our best. So we'll turn it over to Rachel Brown with Visit Durango.
Hi, can everyone hear me?
Morning. Yes, we can, Rachel.
Thanks for having me. So I'm Rachel Brown, Executive Director of Visit Durango. I'm actually joining you from home today. I had a little bit of a cold last week, so just trying to be extra cautious. So thanks for whoever's helping me with these slides this morning. And I'm just going to give you guys a quick update, starting off with an update of Visit Durango, our organization. So as many of you probably heard, Visit Durango was competing for the City of Durango request for proposals for sustainable tourism marketing and management. And there was a study session at City Council on January 4th, where Council voted to award the contract to Visit Durango for 2022. So we're very excited to share that news, and it's a great way to start off the new year. So yeah. We have some new board members joining us this year. 5 will be joining us starting this month: Roberto Casanueva from Outdoorsy, Jenny Roberts from the Hampton Inn, Amber Andrew from Black Diamond Lodge, Ken Stone from Durango Hot Springs, and Nick Borse from Durango Cannabis Company. Hopefully you recognize some of our management and marketing staff. We have made our last full-time hire, so we are fully staffed right now. And that last hire, Waylon Ryan, who currently works for the Southern Ute Indian Tribe, he will be joining us as our sustainability and policy manager in a couple weeks. So we're very excited about that addition. And as you can see from this kind of simple org chart, we have 4 departments, and the newest department is destination management. And you can see from our pie chart there below that it's pretty evenly weighted these days with marketing. So that's definitely a priority for us right now. And I just wanted to share a little bit more about destination management, since I know this is still kind of a foreign concept for some people. It's basically an umbrella term for a lot of things, mainly sustainable tourism, also what we call stewardship or regenerative tourism, you may have heard of. And our working definition of this is tourism that takes full account of current and future economic, social, and environmental impacts while addressing the needs of all stakeholders, visitors, the tourism industry, the environment, and host communities. And part of sustainable, responsible tourism for us is making sure we're attracting the right people to visit Durango. These days, we're calling this the conscientious visitor. It's someone who ultimately adds more value to the community than what they extract or take away. And this value can come in a lot of different forms. It can be economic impact. They can be contributors to diversity. We want people who are sustainably minded. And we also like it when people are what we call drivers of dispersion. And these are people who are willing to visit midweek, in the off-peak season, or visit some more off the beaten path parts of our county. This is our traveler to the county right now. The majority are traveling without children, about a quarter are families, pretty evenly split between the different generations. Our top states visitation, you can see there, the top 5 are Colorado, Texas, Arizona, New Mexico, and California. Our average visitor stays about 2.6 days. The median household income is 63,000, and the number of attractions visited by the average person is 2.1. Obviously, the last couple of years have changed a lot of what we do at the tourism office through this pandemic. As a reminder, in 2020, we made a huge pivot towards responsible tourism. Hopefully you saw some of this marketing material up in town. And we also conducted a resident survey to understand what people really wanted us to prioritize with responsible travel. And we created our Know Before You Durango pledge, which asks visitors to stay healthy, be prepared, leave no trace, be firewise, be respectful, and enjoy Durango responsibly. And this is the first peek at some of our data from last year. We'll be publishing our year in review report here shortly, but to give you a little taste of that, we're looking back at the last 3 years, since obviously those are the most relevant to us right now. And just for hotel occupancy, you can see in 2019, we were at 62%. In 2020, we dropped to 48%. And last year, we were back up to 62%. And even that 48%, while it was quite a dip for us, was we were much more fortunate there than a lot of other destinations. Average daily rate has actually increased from 2019, as has revenue per available room. And our vacation rental stats don't follow quite the same trend. Part of this could be because of the differences in how they track inventory. But in 2019, the occupancy was at 26%, dropped to 22%, and stayed about there this last year. And actually, average daily rate and revenue per available room have dropped a bit from 2019. Even that 48% I mentioned was a pretty healthy number compared to a lot of other destinations. And that's what I attribute our unique advantages that helped us through the last couple of years. People still wanted to visit La Plata County because of several reasons. Mainly, we are remote, we're rural, we have a ton of outdoor rec options here. We're primarily a road trip destination, also primarily a domestic visitor spot. We're affordable, and we have a healthy and friendly culture. So that has all helped us a lot throughout the last couple of years. And then just to give you a quick sneak peek moving forward, some trends for this coming year. So what American travelers are looking for with their travel destinations. They want to have fun, relax, find happiness, escape stress, enjoy nature, get away from crowds, enjoy scenic beauty. They're still looking at road trips, national parks, cuisine, and food. So you can see the majority of these trends will continue to work in La Plata County's favor compared to some other destinations. So that's good news for us this coming year. And then just a point to note that, as this pandemic goes away someday, hopefully, people will begin traveling internationally again. They'll also be back visiting major cities. So those advantages won't carry us forever. Marketing competition will return. It will be high, and marketing will still be a really high priority for us. And then just lastly, I'll give you a couple ways you can get more involved with Visit Durango. We have a number of paid advertising opportunities, most of which are on our website. We also have paid ads in the Durango Welcome Center. We have some free opportunities. So if you have a special deal that you'd like to share with travelers, we will promote that on our website for free for you. We also do a sweepstakes every season. So if you have a product you'd like to be part of a sweepstakes, we'll promote there as well. And then we have a number of advisory groups, obviously our board of directors. The groups I've highlighted in orange are groups that any member of the stakeholder community can participate in. So if you're interested, those are the marketing committee, our sales and services task force, cycling task force, sustainable and responsible tourism task force, and then umbrellaed under that, we have 3 diversity, equity, and inclusion working groups, which are diversity and culture, LGBTQ+, and accessible tourism. And lastly, if you interested in joining a committee or have any questions, obviously reach out to me. Also, at the end of this month, another survey for you guys. We have 2 surveys running, the resident survey and the tourism stakeholder survey. So I'd love for you all to fill out those. And if you have any questions, my email is really easy to remember. It's just rachel@durango.org. And that's all I've got. Thank you.
Super. Any questions for Rachel? All right. Thanks so much, Rachel. Hope you feel better. We're going to skip around just a little bit because I think we're going to be short on time. So we're going to get an update from Mayor Kim Baxter real quick, and then we'll move to Laura.
I think Laura's presentation is really important, and if there's time afterward, I'm happy to wait.
Okay, perfect.
They're out there so more people can hear.
Okay. Laura, we'll turn over to you for an economic outlook. Morning.
Good morning.
Good morning, everyone. You're getting the Cliff Notes version of what I presented last week for Fort Lewis College, but I hope that you'll find it valuable. Basically, we're getting an economic outlook for how 2020 did. Obviously, being January of 2021, I don't have a lot of 2021, or excuse me, I don't have 2021 compiled yet because it's January 2022. So what I want to talk about in this presentation is really the elephant in the room. We all are worried about workforce. We're worried about housing. And really the crux of all of that is our aging population. So as I talk about kind of where we're going in our trends, you'll be able to really see that, you know, the aging is affecting our labor force, our economy, our housing, and even our public finance. So I'm going to go through this kind of quick. I will have my presentation available and I'm happy to answer any questions that you may have. This is our population, or excuse me, our employment starting in 2000 and forecasted through 2023. What you'll see is the national recession dramatically impacted our jobs. We went to our lowest job rate in 2010 and it took us almost 10 years to get back to those pre-recession levels, which is a lot. And then you'll see the impacts in 2020 for COVID. So we did lose jobs in COVID, but the forecast is that we will continue to grow at that steady rate, which you've seen kind of before and after we have these natural and man-made disasters. This is our employment by industry and wage. Obviously, there's high and low wages in every industry, but predominantly, for example, government is considered a high wage job. And we have the most jobs in government. Don't panic, it's not local government, it's our national parks. You know, we have a lot of public land, so that's a lot of what skews, you know, our government jobs. Retail trade is next, and you'll see that's a low wage employer. Healthcare, and then we have accommodation and food services. And what you'll notice where we have the least amount of jobs are actually some of the highest paying in our region. So this shows the change between 2019 and 2020 at the bottom. So those are those same industry sectors. So when you, as a business, fill out your NAICS code, that's how you get cataloged. And it's by your choice. So a construction company who does engineering may pick to be under professional business services and not construction. So you need to know that there's some flex in those categories. But what this shows you, there's kind of the waterfall on the top. This is showing that basically all categories lost jobs between 2019 and 2020, except for agriculture. And our reasoning for that is we're thinking a lot of more buy local, small farms. You know, we weren't traveling, so we were tending to get our food and produce local because obviously we had supply chain issues as well. But this kind of shows you that our biggest job loss, no surprise, was in accommodation and food services. So I want to give you a real quick economy lesson. We have money that comes into our economy. Pretend that yellow ball is La Plata County. So money comes into our economy, obviously through tourism, the exports of goods and services. So like agriculture, they sell their products outside of our economy, that money comes in. Manufacturing is another driver of our economy. And then transfer payments are really retirees. And then obviously your savings, your benefits, your stocks, things that come into our region. And then they circle in our region. And of course, every time we go to Farmington, we leak money out of our region. Sorry, have to put that in there. So we want more money coming into our economy than leaving. That is the most important thing in terms of our economy. And, you know, when you think of economies, you always act like they have to grow. They don't necessarily have to grow, but they have to grow more than what you're losing. So the more you retain your money in your economy, the less you need to grow your economy, if that makes sense. And we lose our money through taxes. I mean, some things we're going to lose. Economies always leak, but we do have ways that we can kind of shore that up. So within the economy, you have two categories. One is indirect based industries, and those are directly related to the money coming in. So Southwest Ag, you know, if our agriculture economy tanks, Southwest Ag is out of business. You know, if our tourism economy tanks, then our hotels are out of business. So those are the direct correlations. The residential services are our quality of life jobs that make our community attractive. Those are our teachers, law enforcement, retail, all of those things that make you want to pick a safe, beautiful, wonderful community. And those also are impacted, obviously, if there's not enough money coming in to you know, buy food at the store, pay your employees, et cetera. So this is our economy in those three kind of pie pieces that I mentioned. 68% of our economy is from money coming in. That's good. Our indirect base, we have 11%. So the Southwest Ags, the hotels, those things that directly support our money coming in. Residential services, I'm very concerned that has already declined 2% in 1 year, and that has been declining over time. And again, those are our workforce, those are our teachers, law enforcement, et cetera. And we need to preserve those jobs to preserve us as a quality community. This is just a breakdown of 2019 and 2020. That is just the 68% pie. So these are the where we get our direct base economy money coming in. And there was very slight differences between the 2 years, which is good because of COVID. Tourism fell a little. Households, which is our retirees, and also our money for benefits of all sorts, unemployment, benefits like food stamps, that all goes into that household category. Those are jobs that are supporting those industries. And then you see everything else is pretty self-evident. Agriculture, mining, manufacturing. Regional services would be our healthcare because it serves more than one county, and also our college. So this is a breakdown by our county. So you can kind of see that in 4 of our 5 counties, households is the largest attributor to our jobs. So that is our retiree economy, because you'll see tourism only in San Juan is that our largest indicator. And then again, you'll kind of see how they compare. Dolores County, not surprising, has a very large amount of agriculture. So now I want to talk money. This is all the money that comes into the county from me and all of you. So you'll see La Plata County is $3.4 billion of personal income in our county in 2020. And you'll see the breakdown. So basically transfer payments, again, the money coming in from retiree benefits. You'll see dividends, interest, and rent. That's our savings. You'll see residency adjustments, which is our commuters. And for example, in La Plata, you see that the commuters, it's actually a -1. The reason for that is we have more people working in La Plata County that are taking their money out of the county to where they live than the balance. And that is not a healthy way to have an economy, because honestly, if I have more people working from Montezuma in La Plata, they are taking their money home and they are spending it in Montezuma County. You'll see some of the other counties on the reverse are benefiting. So San Juan County, they've got folks that live in San Juan County, they work, say, in La Plata, and they take that money back and spend it in San Juan. They're seeing a 6% income benefit based on that. Does that kind of make sense? And then the bottom is employment. This is critical to why we don't have workforce. Look how small our employment bar is. We have less than 50% of the money coming into all of our communities from jobs. Okay. This is the trend we have been seeing. This is from 1970 to 2020. Look at the employment. This is indicative of the aging population primarily. And you'll see, look at the last two bars. I just wanted to compare 19 and 20. Look at the dramatic change in 1 year with our transfer payments, our employment, residency adjustments, all of that. And the commuters go back and forth, you know, based on where people live and work. That one's probably the most in flux. Okay, now I need to talk about population. Colorado, the blue line is basically births and deaths. What you will see is you lived with your family for a whole year in 2020. We did not have a baby boom. So, you know, our population went down, the blue in 2020. That's also, we had higher deaths. So that is kind of our natural, what we do as residents. The red are people that move into Colorado. And as you can see, that is in flux. That's not very predictable. And you can kind of tell in the 90s, you know, when we had a lot of our issues with the energy industry, things like that, the tech crisis, it completely impacts our migration. You'll see that it's gone down in 2020 and it's projected to continue to go down. And based on the state demographer, it's because we are no longer an affordable state compared to other states. Yes, we're attracting people from California, but as we all know, California is probably one of the few states that is more expensive than Colorado. So that's a concern. Now, this is our region, and this is all of those cohorts, your millennials, your Gen X, you know, your baby boomers. And what do you see? The two peak population areas are right around 20 and right around 68. And as you can see, our retirees are a lot higher than our workforce age groups. That's why we have a worker shortage. And look at all the young people coming up. It's very, very low. We do not have enough young people under 18 to replace our population workforce. And what this also shows you is an opportunity, which I'll talk about. We're attracting the 20s because they're coming here for college. How do we keep them, right? So here I mentioned the underage 18 population. This was the last census, 2010 to 2020, showing that most of the state is declining in the under 18 population. Part of that, honestly, is we're having less babies, unless you're in the Front Range. And that's mainly because that's where our young workforce is going. And so again, another opportunity. How do we keep our youth? Yes, let them go to college, but how do we bring them back when they have families so they can be our workforce? And how do we keep our college students that are coming here? This is the projection, the forecast of the 16 to 64. The forecast says we will attract them. And right now, that's because our area is dynamic and it's a place that people want to live. However, that's where affordability comes into play. If we do not have housing and if it's not affordable, we are not going to get that projected movement of workers. So here's our 65 plus. We're also very attractive to the 65 plus, as you can see. And so are other areas of the state. Colorado is attractive. Again, what does that look like for our economy? That means more healthcare, so people can age in place, assisted living, things like that. So we need to be able to adjust our housing as well as our jobs to an aging workforce. And this is all over the country. We are just getting older. You're having less children and we all have birthdays. So I want to also show you that under 18, the kids that are going to be our future workforce are predominantly growing in the minority populations. So when I look at Region 9, I don't have any minority workers in my office, and in the future I will, if I want workers. And so how can I adjust attracting those workers to my jobs? And so basically this is showing what it was for the last census. It is even more so now. This is the share of the population by minority age diversity. And what you see, under 17, look how many of the minority population, they are the only ones having children. And they are going to be our workforce. And in our area, it's predominantly Native American and Hispanic. So how can we make sure that we take that as an opportunity? Real quick on housing. This was from the Southwest Colorado Council of Governments study that they did with Housing Solutions. And we know we are lacking housing. If I can step back with looking at the economy, construction was a huge driver in our economy until 2008. After 2008, it was not. And if you look at building permits, we had over 400 a year up to 2008, and now we're only in the 200s. So we are behind on our housing stock, regardless of population growth, which, as you can see, is not growing out of control, unlike what you hear in the media. So we have a shortage of housing. In this study, it's basically saying in the next 2 years, we need 775 units in Region 9 to meet the employment demand. If our employees cannot find housing, then they're not going to be a secure workforce and they're going to move on. And then long-term housing needs you see at that bottom. I don't really like this chart, but please look at the study to see how they compiled this. But long-term housing needs is that we're going to need about 907 units a year in order to provide workforce, retiree, and our seasonal vacation demand. So that kind of gives you an idea of what we need to do. Let me talk about wages now, affordability. The average wage is basically taking all the low jobs, all the high jobs, and averaging them. So in each county, what you see is that our average wage in La Plata County is $51,000. In Colorado, it's $66,000. So we are lower than the state. But when you look at livable wage, which is something Region 9's been calculating since 1999, we look at, there's a basic expenditures budget that they base a lot of public assistance off of, what you need to make in, for food, clothing, shelter, transportation, healthcare, it's basically a budget. And we take that budget and we localize it for our housing costs, for our childcare, things like that. So we are going to update our livable wages in 2022, but La Plata County's was updated, that's the orange, this year by Local First. So we help them do that. So what this shows is if I'm an adult and I need to make $41,000 to live in La Plata County and not have to have more than one job, not have healthcare, not have an automobile, not have secure housing. If I don't make that, obviously I can't afford to live here. I'm costing the community by being on public assistance, most likely. What you see, most adults can afford based on the average wage, they're okay. As soon as we have children, our community is not affordable. And that's the problem, because who is our workforce? They're the ones with children. Who are the ones that need housing? The ones with children. And I mean, I can give you an example. I'll just say 9R. 9R used to be a 5A school in the 90s and early 2000s. It's now a 3A school. We are losing our families. And that is something that we can really document. And we need to figure out a way to provide housing and affordability to keep our workforce, or we are going to continue to have a workforce problem. Housing prices, you all know. But what I wanted to do is looking at the purchase price, the median home price in 2020 is comparison. And then we have 2021 housing prices. We had a big market, so we have a lot of numbers that we could pull this from. And what we did is we looked at each community and what their average price home was. Let's pretend I live in Pagosa Springs and I'm going to buy a home and my median home is $524,000. I need to make $97,000 to be able to finance that home. 90% of the families in Pagosa Springs do not make that. That, I think, just puts to kind of rest the idea that we are not affordable. Now, it doesn't mean everyone buys a home, but we also have a housing shortage of actual facility, buildings. So not only if I can't buy a home in Pagosa, yeah, I can be there 5 or 6 years. I start having a family, I'm going to need to move. And that's where, again, we will have a workforce issue. So this is kind of how they all tie together. I'm going to pick on teacher salaries because it's close to my heart. We track that every year. And unfortunately, because of COVID and other things, our average teacher salaries have been going down. And average would be your starting teachers that make less and your experienced teachers that make more. The reason it's going down is we have more new teachers and our experienced teachers have retired and left the field. But what this shows you is that in none of our districts in the region can a teacher afford to buy a home right now. And now you wonder why we have a teacher shortage. So all these things really play together. And so really, we do need to look at housing being somewhat subsidized and that we need to build for our workforce almost as a priority. So all of this information, thank you for your patience. And I know I went over, but here's some opportunities. We need to preserve our local residential services. How do we keep our workforce, our teachers, our law enforcement? Because that's what's going to attract people to our area. If we don't have a safe community, why are we going to pick La Plata County and not somewhere else? We need to attract and retain our youth, and that looks different, but we have a college, we have youth coming here. And data shows if a youth can find a job in the community or area where they went to college, 60% of them will stay. So there's some workforce. If we can have the jobs and they can afford to live here. We need to also get more people in the workforce. We had a workforce shortage before COVID because we are aging, but COVID sort of made that more prominent, and that's good. But basically, we have people in our workforce age that could be working, and for whatever reason, substance abuse, mental health, they are not able to be consistently in the workforce. If we have the programming to get them in the workforce, that will help with our workforce shortage. And that means we need more of that type of programming in our community. We need to also provide opportunity for the aging workforce. You know, ideally, when I retire, I may not want to work, but I may want to work, you know, non-traditional hours. I may want to work part-time. How can you, as employers, be open to that? Part-time older workers, don't lose all that experience. You know, what can you do to keep them? Because again, the largest share of our growth is 65 and over. And then how can you adapt and include racial and ethnic diversity in your workplace? Because our workers are predominantly going to be minority populations. And are we ready for that? La Plata County is a very white community right now. How are we going to adapt as we move forward? And then another opportunity, telework. We are attractive. If people have housing where they can work from home, and we have the broadband infrastructure, which we're working on, that is going to attract workers. So those are just some things to think about. I'm sorry about the little joke there. I just thought that was funny. Thank you very much. We also have economic outlooks that Dr. Wobbekind brought with the state economic outlook, and please take those if you need it.
Any questions for Laura on any of that? I know we're a little bit over, but that was a ton of information to digest. Okay, most of you have her contact information. Based off some of those slides, we just had a perfect little baby girl who's like 6 weeks old. I know, it's so exciting. Maybe next one. Yeah. So based off those slides, anyone 65 and over, I'm going to need a contribution from you guys if I'm going to stay here. So thank you, Laura, for teeing that up. You'll find the GoFundMe page somewhere. Mayor Kim Baxter. We planned on going over, so we're good-ish. Good morning. We'll get an update from the city.
So I'm that 65 and older group. You can have my city council salary. It won't help much. So I just want to say everything that we've spoken about tonight or today is really applicable to what council and city staff are doing to help support our economy here, which means housing. And that was, as mayor, that was my number one thing, housing, housing, housing. So I just want to mention a couple of things about housing. And one of them is that the RHA has given out a RFQ for the leadership of the RHA. Who's going to lead it? How's it going to run? How are we going to address the problems that we have in our county? And we've had a respondent on that, so we'll be interviewing them, and I'm very excited. I think it'll be a really good contribution to the community and make the RHA successful. The URA that we have that we're working on, so Urban Renewal Authority, we have a new one that the Urban Renewal Authority Board is working on. It's the North Main Gateway area. So that's basically from 32nd Street, not quite north. And the cornerstone of that development is a workforce housing development, which will have 10 workforce housing and or deed restricted units specifically for our workforce. And there's another 12 units on top of that that are just general open market units. But that's the cornerstone of that URA. The city is working, contributing dollars into this. The URA will be contributing dollars, and that'll start development and hopefully start workforce housing as the priority there. Because that's our big focus, is workforce housing as well as commercial development. As was mentioned before with COVID, we are also short on bus drivers, so our routes have been affected by that a little bit, so be aware of that. And non-emergency police personnel are also been affected. So it isn't that people are out because they're experiencing symptoms, but we don't have any severe cases. It's just a matter, we don't want it to be spread among our community, so we're keeping them out. One of the big things you've probably heard about is downtown's next step, which is the future of Main Avenue. And there's a survey out right now. There was actually going to be a charrette today to have a public conversation about what does downtown Durango look like. Charrette was canceled due to the spread of COVID, but that will be reinstituted, as well as another one, which was planned for January. It may end up in February. But over 900 community members have completed the "What are your values for downtown Main Avenue?" questionnaire. So after that, the stakeholder meetings are being held, and then we'll share the results from the questionnaire and create a vision statement and objectives for what downtown looks like. So this is your opportunity to contribute to that and be a part of it. Bump outs will officially be returning to downtown Durango in 2022. So that's also really exciting. And the Economic Opportunity Division of the city is helping guide that with our stakeholders, such as BID and other downtown stakeholders and the broader community. So we want to know, what does downtown Maine look like? How does it work? So another thing that we're working on is, as was mentioned, is La Posta. So what does that infrastructure investment strategy look like between the county, the city, and the stakeholders who own the properties there? We're very excited about that. The possibilities for where that goes is incredible. So I kind of think, one more thing. So the Economic Opportunity Division has a economic opportunity coordinator, and what they're working on is being the strategic partner between the business community and the city for creating a one-stop shop for small businesses. So you don't have to go here and go here and go here and go here to find out all the information, streamline the process to get businesses going, to get questions answered, to make changes. And so that you'll know who you're talking to, one person, make it happen. So I think that's my brief comments. If you had any questions, I'd be happy to answer them. Okay, thanks.
Well, if anybody else has any closing comments, floor is open, quiet. Okay, we appreciate all you coming. Obviously, some issues kind of facing our community and economy, but get involved. I mean, so many of these problems and issues, you know, they